And thanks for staying with us here on Morning Live. Now, Health Minister Dr. Zweli Mkhize has attributed the slow pace of the country's vaccine rollout to global supply-demand challenges. And in an interview on SABC last night, Dr. Mkhize said that South Africa will only see large numbers of vaccines becoming available in the country by the middle of this year at the earliest. And according to the latest Department of Health COVID-19 report, the total number of vaccines administered to date is 207,808. And this is, of course, cause for concern for many South Africans, including the South African Medical Association. Dr. Angelique Coetzee is the chairperson of the association, and she joins us now to discuss this. Dr. Coetzee, as always, a pleasure to speak to you. Welcome to Morning Live.
Thank you so much, and a good morning to all your viewers out there in Maya. Have a great day today.
And you too. Well, Dr. Coetzee, let's start with this vaccine rollout program. And depending on who you speak to, we either do or don't have a vaccine rollout program. So what is currently going on in that regard?
Okay, so I'm glad that you asked me, because there's such a lot of confusion out there. So one of the most important things to understand is currently we don't have a national rollout. And the vaccines that we have procured under the Sisonke project is due to the help of MRC under the leadership of the, Prof. Glenda Gray. And when they noticed that the manufacturers are slow to bring vaccines into the country, they then jumped in and started to get the healthcare workers vaccinated, as we are all worried about the third wave. So the current rollout, if you want to call it a rollout, is under what I've already alluded to, the Sisonke project. So it's an open study. It means anyone can or are eligible to receive the vaccines. So, and it is a phase 3B. It means it's not looking at efficacy. It's only looking at two things. It will look after the patients or the people receiving the injections for at least 6 months, monitoring them, looking at any other side effects that was not picked up in the phase 3A trial. And this is where we currently are, but we only got 500,000. So luckily, the healthcare workers that registered on the EVDS system is around about 800,000. So if you're not registered on the system, it means you don't want to have the vaccine. So now the next thing that is important to understand, that none of the manufacturers out there will commit to a date or a month for delivery. And I think this is where the confusion is coming in, because everyone wants to know a date. The date is not up to the government. The date is up to the manufacturers. And they are saying they would rather look at the volume by quarters that they will deliver. And although all the vaccine procurement have been signed off as far as possible and as far as we know. So this is what is going to happen. In the formal agreement with Johnson & Johnson, it is expected that there will be 3 million doses coming in quarter 2, 14 million in quarter 3, and again 14 million in quarter 4. Now it's important to understand, if they say 3 million doses in quarter 2, it doesn't mean when quarter 2 starts on the 1st of April, that you're going to get all 3 million in one batch. It will come over the 3 months, that is in quarter 2. So the Pfizer that we have signed on off, there's 5 million coming in quarter 2. Remember, quarter 2 is starting next month. 12 to 15 million in quarter 3 and the balance in quarter 4. And that's it. There's no way that the government can push them to give us clear dates. They go on quarters and that's it. And this is very important that people understand that. Now, the next problem that we're going to sit with is while we can now use the Johnson & Johnson coming in quarter 2 and the Pfizer to finish off all the healthcare workers out there. That includes the secretaries of the surgeries, the people working in surgeries, because they fall under phase 1B. we are going to start with that as soon as all the phase 1A has been vaccinated. Then we will move over to the public. So from SAMA's side, we are very worried about the rollout for the public under phase 2. We know that we have been assured by the National Department of Health that the fridges for the Pfizer will be fine. You know, there's not going to be a lot of logistical problems, they assured us. But we looked at this, and the Pfizer must still be syringed. It's a difficult vaccine, it's small dosages. The temperature is an issue. So we need to make double sure that we roll that out in a huge quantity per day to stay within the 2-week limit of having only been at less than 70 degrees. But it's going to be a challenge, and we are worried about that. We are also worried about the way that people in phase 2, we saw how difficult it was in phase 1, how you are going in phase 2 to make sure that you're registered. So they are also not, they are lenient, and they said, yes, you can have walk-ins. The problem is if you have got walk-ins, people who didn't register, they don't have enough vaccines, what are you going to do? This is in a nutshell.
And such an important nutshell there, Dr. Coetzee, because so many questions arise. For example, you're speaking of people having to be registered so that the administration of the vaccine can be seamless. Do you have a full list of the frontline workers needed to be inoculated? As you say, even now, during this first tranche of inoculations, not all medical staff have registered, because if we have about 1.2 million medical practitioners, healthcare workers, you said there are only 800,000 registered, which leaves you with a shortfall of about 400,000. And in addition to this, I also just want to ask, given that those that have been administered the J&J vaccine, that they have already received some form of inoculation, will they receive another inoculation at some later stage?
For now, Johnson & Johnson is only one vaccine. That's the beauty. Pfizer is unfortunately two. So what we think what is going to happen in the future, remember, this is just speculation, but this is from our experience. Otherwise, I will have people on my back saying, where is the evidence? We think what is going to happen is that COVID-19 is going to become a chronic disease type of thing, like your yearly flu. You will have times where you will get spikes or surges of increased numbers. Then you'll have to re-vaccine or re-immunize those patients or those people, or maybe on a yearly basis, but only time will tell us. But for now, Pfizer will be two. If you had your Johnson & Johnson one, you're lucky, it's only one jab. And
do you believe that there should be calls for stricter regulations ahead of the Easter weekend? Because clearly we are seemingly not on track. Perhaps you have a different view with regard to where we're headed regarding herd immunity and the pace of the inoculation process. Dr. Coetzee?
Well, currently, I think we can forget about the term herd immunity. We will not achieve it. I don't think we will achieve it within the next year. So that's something that I think we can put in the back burner for now. Yes, we are worried about Easter weekend coming up. From SAMA's side, what we would think would be more prudent is to have very, very strict regulations, or not so much regulation, the regulation is out there, but monitoring of the transport. We're worried about the people traveling long distance in taxis and buses. That is actually for us quite a big danger, because it means if you have a super spreader in a taxi, it means you will bring the infection from one province to another province. Yes, the churches might be a problem, but that's easy to be contained, because you can monitor the amount of people going into a church, to go and pray. So again, we are more worried about transport, and also what SAMA think might help is if we extend the curfew. so that we make sure people doesn't go and sit in taverns and canteens and other places after 9 o'clock at night, so that we get them back at home. That will also help to lessen the accidents that we normally have over Easter weekend. So that is more prudent, but anything else, it's not going to make a difference, because remember, we're always saying that lockdowns is there because there's a strain on the healthcare system. Currently, no strain on the healthcare system, thank God for that. But we need to be prudent, and we need to be vigilant. But I also want to make a plea to the people out there. We are all responsible citizens. We're supposed to be responsible citizens. So please wear your masks. Please do the 1.5 meter. Please do the ventilation. And that is something that you need to do. Government cannot impose it on you. It's your responsibility. And with that, my plea.
And just a final question about the winter season coming up and the flu vaccines, the flu jabs that we usually get. What's happening with that? Because we know last year all of that was taken for healthcare workers. So what's going to happen this year, Dr. Coetzee?
Well, some already asked about the vaccine, the flu vaccines, because remember, it's not available yet in the private sector. So we were told that it's available in the public sector. So if it is available in the public sector, I will urge the public, people who's not on medical schemes, please go and get your flu vaccine. Whenever the flu vaccines is going to be available in the private sector, you also need to get that. But we are running out of time with the flu vaccines. And why this is happening, I do not know. And it should not happen. This is a private thing. This is private companies can bring it into the country. This has got nothing to do with getting a license or anything from SAPRA. So here, the manufacturers and the wholesalers also failing us in the private sector. So we're always saying the private sector is so good, but look at the flu vaccines. And I'm also, from SAMA side, we're extremely worried about the doctors and nurses in the military. None of them has been vaccinated. And this is not right. So we are urging Lieutenant General Dabula, please start the vaccine rollout. And it is a Sisonke program for all military healthcare workers. Please, we plead with you, start doing that. You are putting those doctors and nurses' lives in danger by not doing this. Thanks.
Dr. Angelique Coetzee, thanks so much for your time. Chairperson of the South African Medical Association, talking to us about the vaccine and also the rollout or non-existent rollout currently and other COVID-19 related issues. Let's take a quick break before headline news.
If you like nice things at a nice price, you'll love Nazo Meals. Ba-da-ba-ba-ba.
On Stories Untold, we travel far and wide to bring you stories packed with hope and inspiration.
I don't need to rely on government